Now we'll talk about the neurologic system. The motor system and reflexes control everything from muscle strength and range of motion to movement, balance, coordination, and certain involuntary responses. That's why a thorough examination of these parts of the neurologic system is so important. In this program, you'll review the key anatomy of the neurologic system and learn how to examine the motor system and reflexes. With the healthy person shown here, you'll see normal findings. In your practice, you may see the same findings, normal variations, or abnormal findings.
Before examining the motor system and reflexes, consider the relevant anatomy. The central nervous system has three major motor pathways, or tracts. The corticospinal, or pyramidal tract, contains motor nerve fibers that originate in the motor cortex, travel to the brainstem, cross to the opposite side, and pass down the spinal cord. It controls highly skilled voluntary movements such as writing. The extrapyramidal tract includes all of the motor nerve fibers in the central nervous system that are outside the pyramidal tract. These fibers maintain muscle tone and control automatic body movements such as walking. The cerebellar system coordinates unconscious movement, maintains equilibrium, and helps maintain posture. The cerebellum integrates motor information and uses feedback pathways to control the cortex or lower motor neurons in the spinal cord. Reflexes allow rapid reactions via a reflex arc. In the simplest reflex arc, sensory neurons carry the message from the receptor through the dorsal root and into the spinal cord. There they synapse with motor neurons. From the ventral root, motor neurons carry the message to the muscle, which produces the reflex. If the person seems well and has no significant history, perform a screening neurologic examination. If he reports neurologic concerns or shows signs of neurologic dysfunction, perform a complete neurologic examination, which will be shown here.
I had an uncle who had a stroke. He was only 50.
Keep in mind that the incidence of stroke is 2.5 times higher in blacks than in whites, and the incidence of multiple sclerosis is higher among whites. Yet both disorders affect the motor system.
Okay, Mr. Gambrell, I need for you to have a seat on the table for me.
Sure.
For the motor system examination, begin by assessing the muscles.
Okay.
Inspect all muscle groups for size, comparing one side with the other.
And I'm just going to compare
Muscle groups should have no atrophy, be symmetrical bilaterally, and be within normal limits for the person's age.
Now I'm going to test the strength in your arms. Okay? Could you lift your arms up for me? Good. And try to
As you
resist.
would during a musculoskeletal examination, test the strength of homologous muscles simultaneously.
To test the strength in your shoulders.
All right.
I need for you to shrug your
The
shoulders.
person should be able to overcome your resistance.
Good. Now I'm going to assess your muscles. I need for your arms to go limp like a rag doll.
Okay.
Next, test muscle tone, the normal degree of tension in voluntarily relaxed muscles. To do this, first persuade the person to relax completely. Then, move each extremity smoothly through a full range of motion, providing support at the elbow or knee. Normally, you will note a mild, even resistance to movement. As you assess the muscles, you should see no involuntary movements. If they are present, note their location, frequency, rate, amplitude, and ability to be controlled at will.
Now I'm going to put your gown up and then I'm going to ask you to stand.
All right.
To assess cerebellar function, begin by assessing the person's balance. To do this, observe his gait as he walks 10 to 20 feet, turns, and comes back. Normally, his gait is smooth, rhythmic, and effortless. His opposing arm swing is coordinated, and his step length is about 15 inches.
Now I need for you to walk to the wall, heel to toe.
All right.
Also, ask the person to walk a straight line in a heel-to-toe fashion. This tandem walking accentuates any coordination problems. Normally, he can walk straight and stay balanced. In an older adult, the gait may be slower and more deliberate and may deviate from a midline path.
What we're going to do now is we're going to check your balance.
To further assess balance, perform the Romberg test. While standing close to the person, ask him to stand with his feet together and his arms at his sides. Then have him close his eyes and hold this position for 20 seconds. Normally, he can maintain his posture and balance, but may sway slightly.
Okay, you can open your eyes.
As a final balance test, ask the person to do a shallow knee bend or hop in place, first on one leg, then on the other. This demonstrates normal position sense, muscle strength, and cerebellar function.
Now I need you to have a seat on the table.
To further assess cerebellar function, evaluate coordination and skilled movements.
Repeat after me.
Test rapid alternating movements by asking the person to pat his knees with both hands. Lift up, turn his hands over, and pat his knees with the backs of his hands.
Okay, faster.
Then ask him to do it faster. The movements should be done with equal turning and a quick rhythmic pace.
Now I need for you to touch.
Or
your
ask the
thumb
person to
the tip of
touch
your
his thumb
fingers
to each
and then
finger
do it
on the
reverse.
same hand, starting with the index finger, and then reverse direction.
Now with the opposite hand.
Normally, this can be done quickly and accurately.
Good. Now I
Ask
need
the
for you
person
do
to perform the
index
finger-to-finger
touch
test.
your nose and then touch
With his
your
eyes
nose.
open,
As
ask
in
him to
the
use his index finger to touch your finger, then his nose. After a few times, move your finger to a different spot. His movements should be smooth and accurate.
Now I need
Also,
for
have
you
the person do the finger-to-nose test.
I need for you to close
With
your
his eyes closed
touch
and
your
his
index
arms
finger to your
outstretched,
nose.
ask him to touch the tip of his nose with each index finger.
Now you try.
Alternating hands and increasing speed. Normally, this is done with accurate and smooth movements.
Good. Now you can open your eyes.
With the person
Now
supine,
what I need for you to
do the
is
heel-to-shin
your left
test.
heel,
To
place
do
in
this,
front of your knee,
ask him to place
and
his
slide
heel on the
down
opposite
your
knee
right shin.
and move it down the shin from the knee to the ankle.
Excellent. And do the same thing with your right heel.
Normally, he can move his heel in a straight line down the shin.
Good. Now what I need for you to do is to sit up, okay?
For the reflex examination, start by testing the deep tendon reflexes, or DTRs.
Angle.
To elicit and grade reflexes properly, remember these
Your
guidelines.
reflexes.
All right.
Relax the limb and partially stretch the muscle. Use the hammer's pointed end for small targets and the flat end for large targets. Relax your hold on the hammer. Strike a short, snappy blow to the muscle's insertion tendon. Do not let the hammer rest on the tendon. Compare the right and left sides, which should have equal responses.
Okay, what I need for you to do is relax for me.
If the reflex does not appear,
I need for you to come
encourage
forward.
further relaxation. Vary the person's position, or increase the strength of the blow.
Okay, what I need for you to do now is to take your hands, put them together, and kind of pull.
Also, try reinforcement by having the person perform an isometric exercise in a muscle group somewhat away from the one being tested.
Okay, thank you.
After you elicit a reflex, grade it as 4+ for a very brisk hyperactive response with clonus, 3+ for a brisker than average response, 2+ for an average or normal response, 1+ for a diminished or low normal response, or 0 for no response.
I'm going to test the reflexes in your legs, so just relax your legs for me.
When grading reflexes, remember that an older adult normally may have decreased deep tendon reflexes and may have no Achilles reflex.
I'm going to check your reflexes.
Begin reflex testing in the arms with the biceps reflex. Relax the person's forearm by supporting it on yours. Then place your thumb on the biceps tendon and strike it. The normal response is forearm flexion.
Relax for me. Good.
Next, test the triceps reflex.
Okay, I'm going to check your triceps now. I need you to relax your arm, let it dangle a little.
To do this, hold the person's relaxed upper arm. Then strike the triceps tendon just above the elbow.
Okay.
The normal response is forearm extension.
Okay, relax your arm for me. Kind of let it dangle, as if it was going limp. Okay. I'm going to check your triceps reflex.
Alternatively, hold the person's wrist across his chest to flex the arm. Then tap the tendon.
Relax for me.
Move on to test the brachioradialis reflex. While holding the person's thumb to suspend and relax the forearm, strike the arm about 2 to 3 centimeters above the radial styloid process. The normal response is forearm flexion and supination.
Good. Just relax. Now we're going to check the reflexes.
Perform reflex testing in the legs, starting with the quadriceps reflex. With the person's lower legs dangling freely, strike the tendon just below the patella. This should elicit lower leg extension and palpable quadriceps contraction.
Good. I'm going to check the reflexes.
For a supine person, use your arm to support the weight of one leg against the other leg and flex the knee. With this position, you can't feel the quadriceps contraction, but should see lower leg extension.
All right.
Next, test the Achilles reflex. With the person's knee flexed and his hip externally rotated, hold his foot in dorsiflexion and strike his Achilles tendon. His foot should plantar flex against your hand. If the person is supine, flex one knee and support that lower leg against the other leg so that it falls open. Dorsiflex the foot and tap the tendon.
Good. Now I'm going to check your ankle just one more time.
If the person's reflexes are hyperactive, test for clonus. Support his lower leg with one hand. Briskly dorsiflex his foot with your other hand and hold that stretched position. You should feel no clonus, which is rapid rhythmic contractions in the foot and calf.
Okay, relax. I'm going to check your stomach reflexes.
Okay.
I'm going to place this pillow underneath your knees.
Alrighty.
When testing the superficial reflexes, begin with the abdominal reflex. With the supine person's knees slightly bent, use the handle of the reflex hammer to stroke the abdomen toward the midline over the upper and lower quadrants. In response, the abdominal muscles display ipsilateral contraction, and the umbilicus points toward the stroke.
Good.
In a man, test the cremasteric reflex by lightly stroking the inner aspect of his thigh. This should cause elevation of the ipsilateral testicle.
I'm going to check the reflexes in your feet.
Finally, test the plantar reflex by stroking up the lateral side of the sole and across the ball of the foot like an upside-down J. You should see plantar flexion of the toes and slight inversion and flexion of the forefoot. In an infant, plantar reflex testing normally causes the toes to fan out. This positive Babinski's reflex should disappear around age 2.
Your exam was normal.
Great.
Do you have any questions for me?
No.
When you've completed your examination of the motor system and reflexes, discuss your findings with the person and answer any questions he may have. Also teach him about related health promotion and self-care topics to help him stay as healthy as possible.